So obviously we know that many of you still have a lot of questions about COVID-19. So every day we will be checking in with the experts.
Today, we're going to be talking to Dr. Todd Ellerin, Director of Infectious Diseases at South Shore Health. Thank you so much for joining us, Doctor. We really appreciate it.
Good to be here, Maria.
All right, so the governor did extend that stay-at-home advisory through the 4th of May. And I know we keep saying it, you keep saying it, people do know it, but it bears repeating. Why is it so important for people to stay at home, stay physically distant from others, and do the simple things like washing your hands frequently?
Well, we're watching the epidemic curve, and the trajectory is that we're going to be peaking within the next couple of weeks. And that's what it looks like here locally. We're seeing more and more outpatients diagnosed with this disease. So 1/3 of patients who have come to our tent for outpatient testing have tested positive. Remember, the incubation period is about a week or so, 5 or 6 days. Patients mostly have mild illness, but the ones who have severe illness, it's usually a week after that. So if you do that math, things are going to be heating up over the next couple of weeks. So we have to stay home. That's critical. And good hand washing is also equally as important.
Dr. Ellerin, let's go back there. So we're hearing a lot about, and you just mentioned it, the expected surge in the cases and patients somewhere around mid-April. How are hospitals like South Shore preparing for something like that?
Well, first of all, even before we started getting into this, we've done a lot of drilling. A lot of the people on our teams were part of the SARS preparation, part of the pandemic H1N1 preparation, and Ebola as well. So we've got a good team. We're making sure we have enough PPE with materials management. We're checking our negative pressure rooms with engineering. We've got nursing leadership, physician leadership. So doing everything we can. We have tents outside. So it's all about space, supplies, and staff. We're making sure our staffing's prepared, making sure we have enough space for patients. We're regionalizing care, special units like special pathogen units for our COVID patients. We're ready. We've seen a lot of COVID already, so we're experienced and we're ready for more.
So what does the public need to know, Doctor, about that surge? What they could possibly see happening in their community, or if there's someone, I read yesterday someone said, I have a rotator cuff surgery scheduled and that's not going to happen now, and I'm in pain. What do I do about that?
I think the decision to discontinue elective surgery was a tough one, but a very important one. Remember, that's really another mitigation strategy as far as social distancing. We have to make sure we don't have patients who are not ill coming into the hospital. That rotator cuff surgery, unfortunately, needs to be delayed a bit. Hopefully it's a few months. Again, we don't know exactly, but I'm hoping for a better summer. That's what I'm thinking.
South Shore Health has been performing drive-through testing in Weymouth for people with appointments. So what are you seeing there, and what has changed since all of that started?
Well, we started slow just in general as a country as far as testing was concerned. There was definitely some missteps. But over time, as we got testing into the state labs and then commercial labs, and now we're doing testing locally, we have done a better job. So now that we're testing more, we can find the positive patients, isolate them, trace those close contacts and quarantine them, and also hopefully over time we figure out how much penetrance this COVID-19 has had. And if we can diagnose milder patients and asymptomatic patients, then we'll see what the true denominator is. And I think the mortality rate we're going to see is not as high as what we're thinking it is right now.
Oh, good.
Yes, that is good. Dr. Todd Ellerin, Director of Infectious Diseases at South Shore Health. Doctor, thank you so much for being with us, and stay healthy.
You too. Thanks, guys.